Hey guys, Dr. Jessica Finley.
And Dr. Jeff Finley here.
And today we're going to talk about the research study that has the effects of the adjustment on the brain. What they did is they measured brain activity through a PET scan after an adjustment and after rest. They also measured salivary amylase, which is a way to detect stress hormone or stress activity within the body. After an adjustment, what they found is there was a decrease in pain and muscle tension. This was also noted by patients, but they also found this via PET scan. They found a decrease in muscle spindle activity, which led to a decrease in muscle tension. They also had an increase in mechanoreceptor activity, which led to a decrease in pain. Now, mechanoreceptors, what they do is they send a message to the brain anytime there's movement within a joint. These receptors travel much faster than nociception, which are pain fibers. Thus, it blocks off the pain signals being sent to the brain because it's going to focus more on the movement going on within the joint.
Let's talk about a couple of things that they saw locally within the brain itself. One area in particular was in the dorsal anterior cingulate cortex, big fancy words for the portion of the brain that controls the stress response or your sympathetic response, or the rest and digest area, the parasympathetic response in your body. There was also increased activity in the cerebellar vermis. This is the part of the brain that controls the postural stabilizing muscles. In other words, the muscles around your spine that help keep you upright, that help keep you stable and help you move. There was an increase in the activity in the somatosensory association cortex. This is the portion of the brain that contains the map of the entire body, where different things are in the body, what they're supposed to be doing, how they should be functioning. And there was a decrease in prefrontal cortex and temporal areas. In other words, there was a modulation of overactivity in those areas. Besides changes in the brain, they also saw a decrease in the salivary amylase levels. Now, as Dr. Jessica said, they use this as a measure sometimes to look at stress response or activity within the body. So a couple of conclusions that we can take away from this paper. One, with an adjustment, there is an immense amount of activity specifically that is activated within the brain and other receptors throughout the body. The second one is that the paper concluded that due to decreased pain, tension, and salivary amylase levels, it's likely that an adjustment has an effect on a decrease in the stress response that your body is having.
As always, if you've enjoyed our video, hit the like button and feel free to share it with anyone who might find this interesting.